parents really need to be sort of thinking about what is the least restrictive environment for my child. So the natural environment goes away, and in part B, it's least restrictive. And it goes anywhere from being like with their peers at their home school, although not every school has a preschool. So um, to being, well, they wouldn't send a 3-year-old, but to Riverside School for the Deaf or Fremont School, like not, and then I want to preference that for many people, having complete access, especially if you're ASL, and being in an environment where everybody understands and signs with you and they're communicating at the age appropriate level is sometimes the least restrictive environment, right? So Riverside School for the Deaf for somebody might be least restrictive because if I'm the only child in a school who's using sign language with an interpreter, I can't play on the yard and talk, yeah, someone's going to learn like my name is what I'm a fifth grader. How am I going to have a discussion with somebody, right? So this whole issue around inclusion and least restrictive environment gets a little tangled when we're talking about deaf and hard of hearing. Right.
Yeah,
But
absolutely.
let's say the parent has opted, the child has a cochlear implant and they're doing really well. They may want to stay with the least restrictive environment and then they want to look at, well, what services are going to support that child the most. So child's going into a general ed setting, the teacher may not have any experience with a child with hearing loss and a cochlear implant. You still are deaf or hard of hearing. Like it's the right. So the parent should ask for support, right? Will an itinerant teacher be coming in to help the teacher understand placement needs, how to use the mic, how to check that things are working, how to provide UDL uh, services, how to differentiate the instruction, the same thing with the speech pathologist. So they kind of, depending on where they decide to access the services, in which setting, they want to make sure that they have the support for the child, especially for a 3, 4, and 5-year-old, because 3, 4, and 5-year-olds cannot advocate for themselves.